Strategies and initiatives that I wanted to mention. First of all, I wanted to kind of discuss the DFCS action plan to improve safety for children. And that's this chart. Some of this we've kind of mentioned earlier. And with this one, for instance, increasing the number of DFCS case managers, which is what we're doing right now. We've completed the rollout of the centralized intake center, fully training our staff in the safety response model. Then the next to the interviewing training, I think something that was mentioned earlier when Melissa was speaking around really training our staff on being able to assess, do better assessments. So we've started, I think, March 1st with the interviewing child training. Based on some of the lessons learned from child death, serious injury cases, one of the things that stood out to me as I listened to case managers is that we were probably over-relying on the word of the child and to protect themselves. And I think Stephanie made a statement earlier about children not being old enough to speak their pain, and of course also the children not having the words to speak their pain, children being reluctant and hesitant, to speak their pain. So that was one of the things that stood out to us. So we're contracting with Georgia Child Advocacy Centers, and they are doing a 3-day training with all of our staff who do investigations and family support work. They're also going to be training some of our foster care workers around how do you interview children in order to get the best information possible in order to determine whether or not they're safe or unsafe. Because what a child is not saying is just as important as to what the child is saying. There's also this need to really garner trust with the child. So our staff, we've had 82 staff thus far have gone through this. This training will be going on through the end of the year because we have about 1,500 staff at least to go through this training.
And you have full funding?
Yes, right. We're using a couple of grants that we have, namely our CAPTA, Child Abuse Prevention and Treatment Act funds for these trainings. Now, what we don't have funding for that I've been hearing from some of our private provider agencies in particular, they would also like to participate in these trainings too, because it's certainly information that's going to be timely for our children in foster care also. So we do have that one. We've also started another training, that one on interviewing and assessing adults. So Georgia Public Safety Training Center started that. As of, we have about 96 people that have completed that. So again, that will also be investigators, persons doing family support workers, so that they can better assess adults to determine, what's really going on. So we saw a need that we really needed to bring up the skill set and the knowledge of our staff around interviewing and assessing. So we have that underway. We're also doing a review of our screen outs. Earlier, I mentioned that, when a call comes in to our center, we either screen it in or screen it out. Screen outs are to be those cases where there's no allegation of abuse or neglect. In the child death cases that were really high profile that we saw, there were screen outs involved in both of those cases. So that necessitated the need for us to really go back, and we went back for the year from October 1st, 2013, that we're working our way forward, to go back and revisit and take a look at those screen outs.
And have you had any independent peer review to look at those type of screen outs to, because sometimes it's easy to miss things when you look at them all the time in a fresh set of eyes, see things frequently.
Right, we have not done an independent peer review on that. And down at the bottom, we're going to talk about, we have an external review team that's going to be looking at our policies and practices as it relates to child death, serious injury cases. So with this screen out process, though, we do have a team. We had a team that was composed of individuals from all over the state taking a look at cases. So it was not the individuals who screened out the case to begin with. So we did pull a team together, and as of now, they have reviewed 4,185 of the screen outs had come in, and they had what we call an 87% concurrence rate. And that as they looked at those, they agreed that 87% of those were a good screen out based on the information given. And then they sent the others back to be reviewed again, because in some instances they felt there was not enough information that came in from the reporter to really make a decision about whether to investigate or whether to screen it out. And I think we've had, this is about 2% of them that were kind of reopened as a result of this process. And again, this is something that's ongoing, and we're still doing it. The next thing we did, we implemented what we're calling an internal safety panel. This is something new that we've started, and this is a group of our staff, subject matter experts. Right now we have about 25 people. Our goal is to create 4 or 5 pods across the state. And this is composed of individuals outside of the county. What we want to do is to ensure that someone other than the people who work the county and work the case, made the decisions, have an opportunity to take a look at the case with a fresh set of eyes. And also, we're looking at these before we close the case. Most often with our case review processes, we're generally doing, this Monday morning quarterbacking, that the case has already been closed or something is happening, and we're telling staff what they should have done. With the internal safety panel, the goal is before that particular case is closed, we have another set of eyes looking at it saying, I think you should have asked the collateral this question. Why didn't you contact so-and-so? Did you do this? And in some instances, we may also have other individuals making the call. For instance, under that one, we have a contract with CHOA's, that we call CHOA Child Protection Health Team. This is led by Dr. Jordan Greenbaum, who's really distinguished and a national expert in the area of abuse and neglect. So she looks at some of these cases. We refer these cases to her to say, hey, take a look at this and tell us what you think should be done. The other thing that we're asking Dr. Greenbaum and her team to also do is that if this is a case about medical neglect or some medical issue that's involved or other injuries, that she may be able to speak with the doctor for us. Because sometimes I think our case managers may contact the doctor, get one set of information, but what I want to find out is if a doctor contacts the doctor, are they able to then maybe ask questions that we would not have thought to ask and get richer information from the doctor? So we've started that. The Child Protection Health Team is only in a few counties right now, most of them North Georgia. We're going to be working with Dr. Greenbaum in the coming months, because by October we want to expand this network to be statewide. So she's looking at a list of other child abuse experts across the state that can participate on this team. So our hope is that in October we can go statewide. And I'm not sure if you all are familiar with Georgia telehealth, the ability to really do these kind of virtual assessments. So that will be one thing that all of the doctors would have to have, is access to Georgia telehealth. They would need to be a subscriber so that we can do this.
Would that mean that going forward in the future, let's say a case was referred in because a child has suspicious broken arm?
Yes.
And there were x-rays, but a defects worker might not know how to correctly read the x-ray, looking for, you want to look for a spinal fracture.
Exactly.
Right? So would that then would the Child Protection Health Team be able to review those x-rays?
Yes. Right. We could refer those x-rays to them to review. And also what the Child Protection Health Team also does is trainings for staff. So particularly the fracture, what is it called? And that analysis of, it's kind of a forensic assessment almost of the fractures, right. And so they can show our staff those x-rays, and this is how this particular fracture occurred. Here's another set of fractures. This is how this particular fracture may have occurred. So in addition to the consultation, the Child Protection Health Team is also training our staff on the differences between fractures. The external review team, we've just completed a contracting process with a team that's going to work with us on creating more of what I call a model child death serious injury staffing process that provides us with the kind of information that can improve our practice. What is it that we should take away from this particular case? What did we miss? What policy or practice changes that may need to be made? You all mentioned the predictive analytics earlier. We do have a statistician that's working with us now and looking at first the child death cases, and he has over 12 years worth of child death data that he's putting into a model. He also has data from Department of Public Health about all child deaths. And he's been able to pull some vital records because on the vital records, we get a lot of other information such as the child's birth weight, whether or not this was a full-term baby. Did the mother have another child who may have died or something? So there's a lot of rich information that he's going to use to develop this kind of a predictive analytics. So with predictive analytics, our goal from this is, first of all, understand what those factors are. And this was something that was mentioned earlier that we're excited about, to know what is the kind of menu of factors that really puts a child at risk.
I have a question. I know you've got all these various initiatives.
Yes.
Maybe Melissa can help me understand. Aren't there best practices that have already been developed throughout the country that we can just take and apply here in Georgia? I mean, that other people have done versus us reinventing the wheel, just like we do in other professions? Am I missing something?
Well, there are some. So it starts out by saying that there is no known way to go about child welfare and recognizing that state differences really do matter. And so some of these, then I would say that some of these things, Georgia is very much leading the way on predictive analytics. But there are a couple of states that have done that, and we've gotten on board quickly, and we'll be leading the development. Well, we'll be a model in that regard for other states who are
Okay.
and then I do think there are some additional things we can learn. There are always things you can learn from other states if you can appreciate the nuance of their system and how it doesn't relate to ours.
And I want to, one of the processes that we will be going through in this commission is bringing in some folks externally
That's what I'm asking.
who do have best practices.
Okay.
We're going to be working with the Casey Foundation to present to us.
That's what I was wondering,
best
because-
practices.
Right, and we do work a lot with them.
I mean, I hate to see you reinvent the wheel if it's been done somewhere else, okay?
Right.
That's all.
Right, and we have adopted some, and I think as Melissa said also, when Governor Deal stated that Georgia would be leading the nation in our approaches to child welfare. And so we are there. Yes, it is, and people will be calling us to find out about child welfare practices. So with this, we definitely are in the front in terms of these kinds of revolutionary ideals that we're using. And then we're working with pediatricians across the state too, in terms of best practices in trainings and those kinds of things. Mention the CPS Intake Communication Center, and Aaron, as Melissa said, you need to stop me from talking when it's time. Okay. 5 minutes? Okay. CPS Intake Communication Center, just wanted to make sure I provided you all with some information about why we started this and what we're seeing thus far. Again, this is finally Georgia will have one number to report child abuse and neglect.
And do you have money in your budget for marketing this out?
To market this. Right, and that's kind of a trick question. There may be more money now. I don't want to speak too quickly. And that's something that I've charged, certainly, our CPS Intake Communication Center staff and ACF.
Private side?
Yes, we can do that.
If I will, if I may, let us go back and do some analysis on where we need help at on the resources side, and then we'll bring that to the.
You are sitting at the Blank Foundation, you're a room.
Yes. Yeah.